Okay, we can go ahead and get started. Assalamu alaikum, everyone. Can everyone hear me? Thumbs up. Awesome. So just to introduce myself, my name is Leena Berriche. I'm a UTD alumna and I'm a second-year dental student at Texas A&M College of Dentistry, and I'm going to be the moderator for today. So thank you guys so much for attending our pre-dental program. If you are a high school student or a college student considering a career in dentistry and want to know like what it takes to apply to dental school, you're in the right place. So if I'm going to talk a little bit about the American Muslim Women Physicians Association. So they have sponsored this event, and AMWAPA is a non-profit organization made up of women in medicine, dentistry, and allied health professions. So they're dedicated to promoting health welfare and education throughout the community, especially when it comes terms to women's health and education. So as a young woman in a health professions program right now, they provide a wonderful avenue for mentorship as well. So this organization has provided the community with countless free health fairs in the mosques around the DFW area for many years now. They sponsor, for example, our Muslim Student Dental Association at TAMU. They donated over 8,000 masks during COVID right now, and food donations, CPR classes, and they also have some scholarships for pre-dental, pre-med, med, and dental students. So be sure to apply to those. So before we begin our program, I would like to talk a little bit about the Islamic importance of what we do as healthcare workers. And we cannot do that without mentioning Surat al-Alaq, the translated title being the blood clot or the germ cell. So the most striking thing about this surah is that these were the first 5 verses that were of the Quran that were related to the Prophet. And in a time where there was little to no scientific proof of life, the first surah sent to humanity was about the biology of life. He said, "Read in the name of your Lord who created you, created man out of a clot of congealed blood." So that is very telling of the importance of the biological sciences in Islam. So, but something also very symbolic is that God sent his words through a man who believed himself to be illiterate and gave him the power to read these words. This is indicative of God being on the side of literacy and seeking knowledge, no matter what your background or upbringing is. So as students now and as future doctors, we are fulfilling our duty to God and the betterment of humanity by bettering ourselves in our professions and continually seeking knowledge within them. So with that being said, let us dive into our program. Preparing for a career in dentistry from the high school years through the college years. And to present this topic in a little bit, I'll be handing it over to our 4th year dental student, Dana Aborahma from Texas A&M as well. And following this presentation, we will be having a Q&A. So throughout the presentation, if you have any questions, just submit them in the chat below, and we will answer them at the end of the presentation. So also with us today to help me and Dana with the Q&A are the rest of our dental school panel from Texas A&M as well. 3rd year dental student Amira Lawand, and my 2nd year classmates Amin Ahmed, Nagam Ghanem, and Zak Al Khatib. So beginning with Dana, I'm gonna have y'all turn on your mics and your video for a moment and just introduce yourselves in order.
Assalamu alaikum. My name is Dana Abrahma. As Leena said, I am a 4th year dental student at Texas A&M College of Dentistry. A little bit about myself. I grew up in Plano, Texas my whole life, graduated from Plano West Senior High in 2013. I also went to UT Dallas like Leena, graduated in 2016, and started dental school fall 2017.
Assalamu alaikum. My name is Amira Lawand. I did biology at UNT, and then I graduated from RCHS and I'm a third-year dental student.
Emin, are you there?
I can go ahead and introduce myself while we're waiting on Emin to come online. So my name is Zach Al-Khatib, and I went to UT Dallas for undergrad. I majored in biology. I grew up in the Dallas area, and so for me, it was kind of a no-brainer to come to Texas A&M, and I'm a second-year dental student.
Hi, I'm Naram Ghanem. I'm a second-year dental student. I also graduated from UTD, and yeah.
Can you guys hear me now?
Yes, we can.
Okay, yeah, guys, I'm a second-year dental student. I also graduated from UTD, and I was a biology major.
Awesome. Thank you guys so much. You're going to be helping us with the Q&A. I'm going to go ahead and hand it over to Donna to start the presentation.
Okay, assalamu alaikum everybody. We're gonna go ahead and discuss the pathway to becoming a dentist from high school to college and a little bit of what to expect while in dental school. We'll start off with considering dentistry as a career option, some advice for high school students, advice for college students like what to major in, what extracurricular activities to be involved in, about preparing and taking the DAT, the application process, interview, a little bit about the dental school curriculum, and then finally we'll end it with submitting questions in the Zoom chat for the Q&A with our dental panel. So why dentistry? I feel like if you're someone who likes science, who loves the arts, who has kind of an eye for aesthetics, and also wants to be involved in someone's overall healthcare, then dentistry is a pretty good profession for you. You make a big impact on the oral health care, which actually influences and affects systemic health care. That's something that a lot of us did not realize or don't know about dentistry. I personally didn't really know until I got into dental school how much your mouth affects the rest of you. It's also very socially interactive. You're always constantly talking to patients, talking to other dentists, other students. So if you're the type of person that doesn't like to just sit in an office isolated from everyone else and you want to be surrounded constantly by people, it's also a pretty good profession for you. Again, as I said, it's very hands-on. I'm personally a very hands-on person. I love to paint, draw, bake, cook, do anything with my hands. So dentistry just appealed to me from the get-go. It also is a combination of science and art. I didn't really realize that until I got into dental school about how much you need to be able to see color and shapes and have an eye for design, basically. It's also got great job security. I mean, everyone will always need to go to the dentist. Teeth are not going to go away, so unemployment rate is only 0.9%. And also you have the ability to work in a practice, or you can work for yourself. You know, you've got a lot of options of what you want to do post-graduation, and you've got a pretty good work-life balance as well. So the US News ranks dentistry as the #1 healthcare job, and then #2 in overall top 100 best jobs. And then this little image here basically depicts that dentistry is a combination of being a doctor, an engineer, and an artist. All right, we'll start with high school. So what should I be doing as a high school student? Keep an open mind, whether it's regarding dentistry or any profession in general. Be open-minded to any kind of career. If your dentistry might be something that appeals to you, see if you have an interest in science classes. Are you interested in healthcare in general? Do you like working with your hands? It's never too early to try to explore different careers. You can contact a dental professional practitioner. There's a lot of dental offices literally everywhere. You can ask them and they'd be eager to have you come in and see, you know, what their daily life is like. Also develop good habits as a student. Time management is incredibly important, not just in high school, but in college and in dental school as well. You also need to be able to work hard. as a pre-dental student and also as a future dental student. Okay, so what should I be doing as a high school student? Apply for a summer pre-dental enrichment program. Texas A&M and a bunch of other dental schools actually offer that too. It's offered for 10th through 12th grade, and it's also available for college students. And not just A&M offers this, but also dental schools. I'm sure San Antonio, Houston, out-of-state schools offer it. I know down here it says that it lasts from July 13th to July 17th, but it's about a month long. They offer a lot of help with SATs. They kind of show you dental labs, get you in there and start practicing hand skills. And it also makes you a more competitive applicant for college. Okay, so what should I be doing as a college student? We'll start off with freshman year. Start off like with the basics. What are you gonna major in? Dental schools do have a heavy emphasis on a science background, but that doesn't necessarily mean you have to major in biology or chemistry or something science-based. I personally majored in healthcare studies because I felt like that encompasses everything that I needed to get into dental school while also exploring healthcare in general. One of my classmates majored in music, another one majored in Spanish. It's just what matters is that you take your science courses, your prerequisites, you take some upper levels, and you really show that dedication into getting into dental school. So it doesn't really matter what you major in. Again, work hard in all of your classes, especially the science ones, because you want to have a competitive GPA, not just an overall competitive GPA, but especially in science. And it also helps you prepare for the DAT, because, you know, biology, organic chemistry, we'll get into that later. Those are subjects, major subjects in the DAT. It's also a good idea to become involved in your university's pre-dental association or pre-dental society. That helps you get into the loop and also learn more about dentistry and get involved with dentistry. Also look up ways to get involved in the community. It doesn't have to be something necessarily dental based. You can get a tutoring job, you know, on campus or even off campus. There's also on campus jobs and other volunteering opportunities through the university or outside. And again, just like in high school, it's a good idea to reach out to dental offices to start shadowing and learning more whether or not dentistry is the field for you. All right, now choosing your college major. As I said before, you don't need to be a biology major to get into dental school, but there are still a lot of biological science prereqs that you need to take. And that can be done, you know, no matter what major you select. The required courses for dental school in general are Gen Chem 1 and 2, OChem 1 and 2, Biochem 1, Statistics, Bio 1 and 2, Physics 1 and 2, and English. And then highly recommended, some schools will actually require it, others just put an emphasis on it and it makes you look like a better applicant. Those are anatomy and physiology, microbiology, immunology, biochemistry 2, labs, genetics, etc. Make sure if you have decided, you know, dentistry is for you, look up what schools you're interested in and look at what prerequisites they have and make sure you fulfill those requirements before applying. And in asterisks, those are what's required by our school, Texas A&M College of Dentistry. Okay, extracurricular activities in COVID. So obviously because of the current situation with the coronavirus, shadowing opportunities have been limited. A lot of dental offices are closed and the ones that are open are hesitant to let other people come in. There's still other ways you can make yourself a competitive applicant. Increase your dental knowledge by reaching out to dentists, you know, on the telephone or through email for a Q&A. You know, I personally did that this summer. I reached out to 3 dental offices and just contacted them. They'll contact back. They'll be eager to answer any questions you have. There's also a lot of dental podcasts online. There's dental procedures you can watch on YouTube. Instagram, there's a ton of dental pages, a lot of dentists that post their work, and also you can DM them and contact them and they'll answer any questions you have for them as well. AMWPA, lots of volunteer opportunities. I know they've been distributing masks around the DFW area. You can get involved with that. You can also join research labs and do online tutoring. Zoom has obviously been such a great resource for all of us. You can tutor through that as well. Not all of your volunteer and leadership experience needs to be dental related. You need to find a balance between having dental activities and also having community activities that you personally enjoy. Dental schools are also pretty understanding, especially with those who are applying right now. They know the current situation. They know that you don't have the hours you necessarily need, but focus on aspects of your application that you can control, like your DAT score, your GPA, and then let that kind of make up for the lack of, shadowing and volunteering because of COVID. So this is something that I didn't really realize until I was in college, but you don't want to kind of oversaturate your application with a bunch of activities that you maybe did once or twice. It looks a lot better to have quality over quantity. Maybe you have one or two activities, extracurriculars that you fully gave your all in, that you have a leadership opportunity in, that you constantly volunteer in, you're invested in, and that shows your ability to make progress and your willingness to promote, I guess, yourself. On the contrary, less involved, but in many extracurriculars, that kind of just saturates your resume with a bunch of information. It doesn't really show dedication or commitment to one thing, and it doesn't show your ability to grow or even leadership. All right, we move on to sophomore year of college. It's basically similar to freshman year. You still want to maintain a good science GPA, overall GPA, keep participating in extracurricular activities, maybe apply for an officer position at the pre-dental society or whatever student organization you're involved in, seek promotions and leadership roles. It's a good opportunity to get to know your professors, and maybe if you get an A in one of your science courses, it'd be a good idea to become a teaching assistant. And I'll let y'all know later on why that would be helpful. Also develop relationships with your professors, especially science faculty, and whatever dental office you're shadowing in, try to develop a good relationship with the dentist. And also start thinking about the DAT. It's never too early to start preparing. The overall accepted GPA of students in dental school is 3.74. So that's pretty high. It's really important to kind of keep yourself as competitive as you can. All right, now we move on to the DAT, the dental admissions test. That one is usually taken at the end of summer of sophomore year, which is the route I took, or you can take it the end of winter of junior year. Personally, I feel the earlier you take it, the better. That way, if you don't like your score, you can re-prepare, restudy, and have more time to get the score that you're looking for. You know yourself best. You've been a student at this point for a very long time. You know how to study, you know your routine, you know your time management. Some people might just need 3 weeks to study, which I had friends that did that, or some of you might need 2 to 3 months, if not more. I personally took about 3 months. I paced myself, did practice tests, and took the exam at the end of summer of sophomore year. What's also really helpful is to find study materials that have been tried and proven true. Some of those, and I actually used almost all of these, are DAT Bootcamp. It's underlined for a reason because I personally feel that was the best resource to use. DAT Destroyer is also pretty good. Chad's videos are fantastic. And I also used Kaplan Self-Study. I know some of you might want to do like more of a classroom base. You're the kind of person that can't self-study and you need to have a schedule made by someone else and to have other students also studying. I know Kaplan does offer courses, but I think because of COVID, they'll probably be doing it online. If that's something you're interested in, you can do that through Kaplan as well. I'm personally a solo studier. I study best when I study by myself. Again, really important. We were talking about time management in high school and being organized. It's important to still continue that. Make a schedule and stick to it. The best way to study is to practice, take practice tests, do practice questions, and time yourself because this is a timed exam. Make sure you're able to answer questions as quickly and efficiently as possible. So personally, though, when it comes to practice tests, I feel that you need to get a good amount of studying done before you take one, because it can be discouraging when you take a practice test just to see what the test is like and end up with a pretty bad score. I can tell you from personal experience, my very first DAT practice test, I failed. I did horrible. I literally got a 14 on one of the sections. And it's because I didn't give myself the time to prepare and to study. I just went in blindly, and it discouraged me. But, you know, I made a study schedule. I studied really hard. And then after about a month or so, I took another test and I did much better. So do not try to take a practice test from the get-go. Give yourself time to study. Nowadays, the average DAT score of accepted students is 21.3, which is pretty competitive. And keep in mind that the DAT can only be retaken after 90 days, and you have a maximum of 3 times to take it. However, unlike the MCAT, your scores do not get averaged, but the schools will still see all the scores that, you know, your previous attempts and what score you got. So it's important. That's actually it can be beneficial to you, because it can show, you know, how hard you worked and how you worked on your weaknesses and you maintained your strengths, and how you sort of just climbed up and got a better score by working hard. Okay, we move on now to junior year of college. Again, keep up with your coursework, extracurriculars, leadership roles. And then now is a good time to start thinking about the application process. The Pre-Health Advising Center, almost every university has one. I know at UTD it's called HPAC, Health Professions Advising Committee. They are a fantastic resource. I personally use them. They offer, you know, help with personal statements. They can help you with letters of recommendation. They do mock interviews, and they sort of walk you through the application process, especially if you're not very familiar with it from the get-go. Keep in mind, though, you have to apply to dental school a year before you wish to start. So if you plan on starting immediately after you graduate from college, you should apply the summer of your junior year. Letters of recommendation, it's really important to ask early. Professors are really busy. You know, they teach a bunch of courses. They have their own personal lives. A lot of them do research as well. They're going to forget if you ask them one time to write a letter of recommendation. You have to keep going to their office hours, keep reminding them. The earlier you ask, the more time you have to finally get your letter and be prepared to apply. Okay, personal statements. Highlight the good intentions you have in going into dentistry, which is basically to help others. Elaborate on a profound experience. Don't try to keep your personal statement busy with a bunch of details, a bunch of stories. Keep it focused or centered on maybe 1 or 2 things and have it go back to one theme. Focus on something that's shaped you and your career interest. It doesn't necessarily have to be something dental related, but maybe something that you experienced, something that opened your eyes to dentistry, and something that you can tie into why you want to go into this profession. Make sure you keep a strong narrative voice. Highlight the things that make you stand out, because, you know, they get hundreds and hundreds of applicants every single year. And so you need to focus on what's going to make you stand out, and your personal statement is one of the most important things that will do that for you. Get advice from advisors. The advisory committee that universities have, they offer such great advice. I know I went to them for my personal statement, and they really shaped it into something I really liked. Make sure you proofread, and proofread. Things you shouldn't do, do not relist your resume. They're not interested in reading that again. Don't ignore the optional essays. It's actually a pretty easy way for schools to weed out applicants. If something's optional when it comes to the application process, don't see it as optional, see it as mandatory. Don't use cliches either. And again, don't stray from your main topic by becoming too busy with your essay. So this SpongeBob meme kind of shows what it feels like to write your personal statement. I personally felt this way. You know, you're sitting at your desk writing for what seems like hours, but in the end, you've barely written anything. But don't be discouraged by that. Keep writing. Give yourself enough time to write it. Some people, they can just sit and write and just write and write and write. It doesn't have to be something perfect the first time you write it. Just write whatever's in your head and you can edit later. Okay, application process. Only apply to the schools you would be willing to attend if it came down to it. I know from personal experience, I applied to several schools that I had zero interest in, and I just applied for the sake of applying. But if I could go back and change things, I would have applied just to the schools I was really interested in applying to. So there's 2 application portals. There's TMD SAS, that one's for Texas, and then AAD SAS, that one's for all of the out-of-state schools. It's really important to apply early. So if the applications open up, I know for Texas, they open up in May, and then for out of state, they open up in June. Try to have your application submitted around June and as late as early July. Also, do not lie and bend the truth on your application. So this never happened to me, but I know of someone who wrote in their application that they know how to play the piano. And so at their interview, there was actually a piano close by, and the interviewer asked him to play the piano for him. Luckily, he didn't lie, so he actually did know how to play the piano, but basically be prepared to defend whatever is on your application. If you're asked about something and it's something you don't actually do, they can see right through that. So this Pikachu meme says, student falsely claims to be fluent in Spanish on dental school application. Interview starts to interview in Spanish. Don't be Pikachu. If you actually know how to speak Spanish fluently, then say so. If you can't speak it fluently, don't say so. Don't say you can. I know it seems like common sense to, you know, don't lie on your resume, don't bend the truth, but you would be surprised at how many people actually do lie about it, and it does not look good on you. It doesn't have a good reflection of your character. Okay. What's that, the next one? Sorry, I think I skipped a slide. Yeah. Okay, letters of recommendation. So what's required is to have 2 from science professors and then 1 from a dentist. So the reason I said, you know, I'll get back to teaching assistant and why that's important is for this, for the letter of recommendation. The more involved you are with a professor, the more that, you know, the office hours you attend, if you are a teaching assistant for them, then they get to know you pretty well. And then they'd feel confident to write you, you know, a personal recommendation letter rather than something that's bland and generic. It's also recommended, if you'd like, to have a mentor that can speak positively to your character, but it's not necessary to have that. Again, I said this earlier, but it's really important. Ask early on for the letter of recommendation. These professors are so busy, they're so forgetful. Just keep reminding them, keep asking them, and eventually they'll write your letter. Or in my case, one of my professors actually had me write my own letter, and that was kind of a scary experience because how do you write about yourself? Make sure you only ask from those who know you very well. Again, by going to office hours, you know, these professors, they have over 200 students. They can barely keep up with anyone. So try to make yourself stand out, ask questions in class, go talk to the professor after class, go to office hours, be a teaching assistant, and really let that professor get to know you very well so that they can write you a good letter that actually, you know, attests to your character. You can actually have up to 5 recommendation letters. I personally just did 3. I didn't try to ask for more, but it wouldn't hurt to ask for another 1 or 2 if you feel like that person can speak positively about you and truthfully. And now we move on to senior year of college. You have finished the application process, you're finishing your courses. It's a good time to be practicing for the interview. Maintain your usual course load. I know for me, by senior year, I was basically done with all of my classes, so I was able to take something for fun. And I personally recommend that. I took literally a literature course about Harry Potter, and it was so much fun. And you know, if you're interested in art, if you're interested in a language like Spanish or Arabic or Japanese or what have you, I really recommend you take it. Try to have some fun your senior year. You've worked hard and you deserve a break. Your grades and GPA, though, are still important. This is kind of a trap that people fall into, in that when they submit their application, they're like, oh, well, they already have my GPA, they already have my grades, I can just cruise by, it doesn't matter if I get a B or a C in this course. So dental schools still want to see your final GPA. So if you bomb anatomy and physiology, that's not going to look good. Again, maintain your leadership, maintain your extracurriculars, still continue shadowing, and then start assessing your acceptances. Texas schools typically give out their acceptances December 1st, but just keep in mind that you might not necessarily get accepted December 1st. I know most people do, but I was from the crowd that got nothing December 1st, and it was very discouraging and disappointing, but just keep in mind that it's not over until the school year starts. Dental schools will still be reviewing applications, they'll still be contacting you up until basically the first day of school. Also, it's a good time to develop healthy habits before you start dental school, especially when it comes to exercise. I personally, once I started dental school, my exercise schedule just went out the window. I just stopped working out completely, and I feel like I should not have let that escape, especially since dental school is so busy and so time consuming. Always try to leave time, to work out, to cook, to do something that you really enjoy. That's something that's honestly very important. Okay, we move on now to the interviews. So inshallah, interviews would be starting, they would start sending out the invites probably around August, and they would start around the fall of your senior year. And this is honestly very true. The interview starts the moment you arrive on campus. The interview doesn't start when you sit with the interviewer and they start asking you questions. They will be assessing everything from the moment you walk in, your interactions with everyone, with the dental students who are giving the tour, with the other applicants, with the professors. Stay focused on the major points you would like to convey about yourself. Don't get too busy trying to talk about 10 different things you've done. Focus on what highlights you as a person. Prepare for common questions. These are some of the most common questions. And I know I've been asked at least 5 of these. What do you like to do in your free time? How do you handle stress? What are your strengths, weaknesses? What's the reason you applied to this school? What's the reason you want to become a dentist? Do you have any questions for me? It's a really good idea to have questions prepared for your interviewer because that shows your interest in wanting to converse with them. Also, something that's really important that I did not know at all until I was in the application process is to apply when you feel ready. I know most people apply at the end of junior year so they can start immediately after they graduate from college, but that's not a must. You don't have to do that. It's okay to take a gap year or two, to work, in a dental office, maybe to shadow some more, maybe to get a master's degree, and to really think and decide if dentistry is what you want to do. You know yourself best, so do what's best for you. And also, you've worked so hard, you've come this far, don't doubt yourself. If there's something, maybe you did poorly in one course or another, it's okay to retake it and try to do better. Also really important, not just during the application process, but in life in general, avoid comparing yourself to others. It's such an easy trap to fall into. I know I've personally done it so many times in dental school, but everyone goes at their own pace. Everyone's their own person. Not one person is exactly like the other. So just focus on yourself and on your own path. And if there's a will to get into dental school, there is a way. I know one of my professors in college said, if you have it in mind that you want to become a dentist, you're going to become a dentist no matter what. There are many routes to get to where you want to be. Not everyone has to follow the same path. And this is a quote by Susie Qasim: doubt kills more dreams than failure ever will. And I can say that is very true. There's this quote that someone once said to me, and I still think about it, and it's that you're your own worst enemy. And I 100% agree with it. Okay, now we move on to dental school. So the first year is mainly lecture-based. Unfortunately, you're going to be sitting through hours upon hours of lecture through biomedical science courses, microbiology, anatomy and physiology, immunology. That's why it's really important to take those courses in the undergrad level so you're familiar with it when you get to dental school. And you also get to do some sim lab exercises. Second year, you're still taking didactic courses, but you're shifting a lot more into preclinical work. You're mostly in the sim lab. You're learning about nitrous oxide, local anesthesia, medical emergencies, pharmacology, and it's just preparing you to get into clinic. And then you get to third year and you're in clinic, you're treating patients, you're going through rotations, you're taking selective courses like public health and athletic mouth guards. And you're just really preparing and putting all that knowledge you spent first and second year into practice. And then fourth year, it's the same thing as third year, but just a little bit more intense because you're literally going to graduate in a year. And this is based on Texas A&M College of Dentistry, the curriculum, but most schools are basically follow this format, which is where they focus on the first and second years on didactics and simulation exercises, and then third and fourth year, you still have some classes, but you're mostly in the clinic, you're treating people face-to-face. And just as the years go by, you take more and more dental-related classes. Okay, that is it. If you have any questions, please submit it in the chat, and then our panelists will be more than eager to answer your questions. Thank you so much for listening to me.
Awesome. So we already have one question from Hafsa. Sorry if I pronounced that incorrectly, but I'm going to attempt to answer this. And if anyone else has any experience with it from the panel, please feel free to chime in. I'm from Morocco. I got my baccalaureate and graduated in 2013. After that, I graduated as a dental prosthetist on 2017. I worked as a year. Now I wonder if I can access to the dental school. So
how does this work?
So you would just, can you type up the questions in the chat, and that way we're just going to go through and read them out and answer them with the panel. Have you been able to access the chat?
Yes, of course.
Okay, awesome. So back to Hafsa, I believe a prothésiste dentaire in Morocco is the equivalent of a dental lab tech here. So if you want to access dental school as to become a dentist, I think you would still have to fulfill your requirements, your prerequisites, like your basic sciences. And people usually do that through a 4-year undergrad institution. So you would have to probably take your Gen Chem, OChem, all of that, and take the DAT, because from that, a dental lab tech here is kind of a vocational program. So it's not via dental school. Does that help answer your question? Okay, well, if you have any more to add, you can message me privately. The next question, when are high schoolers allowed to start shadowing health professionals? Does it depend on grade?
I'm in elementary.
Who wants to answer that? Did any of y'all start shadowing in high school?
I shadowed my dentist, my family dentist in high school, and it's a really good idea to start in high school because when you enter college, if you start, signing up for biology courses and doing all of these prerequisites without knowing if this is really what you want to do, then it can be kind of tough if you decide you want to change your major later on, since you've already taken all these courses and spent all this time and money. So it's a good idea to start shadowing in high school if you can. I would suggest you reach out to your family dentist or a local dentist. You can just call them and say, hey,
I need braces.
Huh?
I need some braces.
Okay, well, so as far as like getting dental work done, you can always, reach out to those who are like the providers in your area. But as far as like, trying to learn more about the profession to become a dentist, then you want to make sure that you specify to that person that you're interested in dentistry as a career and that you want to learn more about it. So that way they can take you in as a student. I hope that helps. Leena, do you want to go ahead and move to the next question?
Sorry, I just realized I was on mute. Thanks, Zach. The next question is from Naba Iqbal. I was wondering if by any chance the medical webinar was recorded and I can get access to it. It's actually on the mwapa.org Facebook page. So if you request access to that, I believe they'll grant it to you and you can go watch that.
What Facebook? Could you repeat that? Sorry.
I'll type it in the chat. It's called mwapa.org.
Thank you.
No worries. Does that help?
Yes, it does. Thank you.
Awesome. So just a reminder, the chat button is below if you didn't find it yet. The next question. I have a question about when to get interviewed. Do you have to send an email afterwards saying thank you?
So
I think
you want to go now? You go?
you can go on.
So after every interview, what I would do is, because there's specific professors who interview you, I would ask them for their card. So because they're going to be the ones that kind of like write in a report on you and get back to the committee of how they thought your personality was, etc. And I always did send a thank you afterwards. And honestly, try to do it as soon as possible. Don't delay it, because I did, when I did an out-of-state interview, and I asked them when they meet up, they said they meet up at the end of every week and they discuss the candidates, and they usually make the decision from that pool of candidates that week, end of the week.
And don't be discouraged if they don't get back to you. It's not going to hurt you in terms of getting accepted.
Just to add to that, about when you get interviewed. So interview invitations get sent out depending on how early you apply and how competitive the application is. So I was someone who kind of submitted my application a little bit late. I submitted my application mid-July. I started getting my interview invitations to be interviewed in September. So all my interviews were in September, but it really depends. Some people got interviewed in December, some people got interviewed in January. So don't let that discourage you, because some schools select some applicants from certain time, like they don't necessarily all pick all the applicants based on who interviewed first. So the next question from Sabir. If you went back in time, would you change your major and study something else besides dentistry? If not, why? Does anyone want to take that?
Okay, maybe the first year, but not after you like go through all these exams and you finish all this coursework that they load onto you the first year. But once you start working in lab, it's a reminder that this is actually a fun major and that you chose it for a reason.
Yeah, and I would argue that really there's very few professions out there, especially in the healthcare field, that are as great as dentistry, in my opinion. I mean, every position that you can get in healthcare is important and it's very valuable and fulfilling. However, in my opinion, dentistry is just so unique and kind of like Dana was mentioning, all those things that go into it, and it's really hard to find another career that has all of those things, like, you know, working with people, working with your hands, having some, you know, aspects of art and giving back. And so I think it'd be hard to find a job or a career that matches what dentistry can offer. So for me, I really wouldn't go back and do anything else.
Awesome. And I think just try to get as much experience as you can to make sure you're making the right decision. I wouldn't necessarily change my major or do something else besides dentistry, but during dental school, there are some days that you have a million exams and you're like, oh my God, maybe I should have just did something right after undergrad, but those are just a select few days. But I personally wouldn't. Like Zach said, there's like, and how Dana said, dentistry is the #1 health profession by US News. And so just try to shadow as much as possible. Shadow if you're interested in medicine, shadow them, or shadow physical therapists. Just try to diversify so you can just make sure you're making the right decision. The next question is from Rashida. What high school courses can you take if you're interested in medical school or dental school? So I personally in high school took a health science rotation seminar. So it allowed me to like shadow in hospitals, and I became a certified nurse assistant. And I worked in nursing homes, but it didn't give me much exposure to dentistry. But I think a lot of high schools are starting to offer that. So if your high school does, I would go for that. And if you're interested in dentistry, like Dana said, the SPEP program is open for 10th through 12th graders. So that's a good way to introduce yourself to dentistry. And it's a very competitive program. So if you get accepted, it puts you, you have a good foot in the door for dental school. Anyone else want to add anything?
Yeah, so I went to Plano High School and they offer clinical rotations. I'm not sure what other school districts do, but if you're interested just in healthcare in general, you can take medical science, which is like a year-long course, or you can do the clinical rotations, which like you said, you rotate in hospitals and doctor offices and some dental offices too. I actually got to rotate in oral surgery and general dentistry. And that's a pretty good exposure to healthcare to see if that's what you're interested in before you try to decide on dentistry.
Awesome, thanks, Dana. So the next question is from Amna. From your own experience taking the DAT, what order do you believe science courses should be taken to be more prepared? Does anyone have a desire to take this question? If not, I can answer it.
I mean, you have to take certain courses whenever you sign up for, biology classes or chemistry classes. They only allow you to take them in certain orders, depending on the university. And so I think the best approach is to take your biology 1 and 2, your general chemistry 1 and 2, and your organic chemistry 1 and 2 in the first 2 years of college. That way, once you've gotten those out of the way, not only are those prerequisites for other upper level courses that you're going to have to take, but those are also going to provide you with a lot of the knowledge that you need to take the DAT. And so most people that I know will, after finishing their biology courses, like their intro to biology courses, general chemistry and organic chemistry, they usually take their DAT that summer following the completion of organic chemistry too, which is most people will finish that in the spring semester of their, second or third year of college, depending on, if you were a transfer student or not. And then you should be pretty ready as far as the sciences go for the DAT.
Awesome, thank you, Zach. So for the next question, it's from Hafsa. What is the DAT? So the DAT is the dental admissions test, and to be accepted into dental school, it's the test you have to take. You can only take it 3 times for a maximum of 3 times, and only you can only take it, like you can only repeat it after 90 days. So the dental admissions test has biology, gen chem, organic chemistry, quantitative reasoning, which is math, a reading portion, and a perceptual ability portion, which is like trying to imagine things in a third, the third dimension, sorry. So it's just, a lot of people take their prereqs right before, like Zach said, right before they take this exam. And I personally used DAT Bootcamp, Chad's videos, and DAT Destroyer. And with those and my previous knowledge of my science courses, I was well equipped and prepared to take the DAT. Okay, I'm trying to find the next question.
By the way, guys, if we didn't answer your question completely, feel free to follow up with us in the chat.
So the next question is from Salsabil. How did you divide your shadowing hours? Did you do the 50 hours over the course of the 4 years?
I personally didn't know I wanted to do dentistry until my sophomore year. So it's not necessarily like right from the get-go, you have to like freshman year start doing shadowing. But that being said, since your application is like in a year in advance, it's highly like encouraged to do most of your shadowing hours before you kind of submit your application, just because that's like one of the things you can write. For how much I would do, it kind of would depend on the course load. Sophomore year, I probably did a little bit more than junior year, just because like the sciences weren't as hard sophomore year compared to junior year when I started taking anatomy and stuff like that. So it kind of has to do with time management and looking at your course load, because at the end of the day, like you don't want your grades to suffer just because you're trying to get in a lot of shadowing hours.
Yeah, and to add to that, you definitely want to do more than 50 hours. I mean, that's really on the low end. Most people who are applying to dental school are getting 100 or more. So if you can get that before you apply, that would be ideal, because they want to know like that you have really taken a deep look into dentistry and know what you're getting yourself into. They're not going to really think that you know what you're really getting yourself into if you've only shadowed for, let's say, 30 or 40 hours and you're applying to dental school.
Also, how I divided my shadowing hours, I tried to do as many hours as possible during my breaks, especially my spring break. So for like my spring break, I shadowed basically full time at an office. So that gave me about 40 hours. So I did that like sophomore year, junior year, and I also tried to shadow at some specialty offices like an orthodontist. So just try to take advantage of like the options. And yeah, breaks was a good time for me. It might not be good for you, but that just was good in terms of my course load. So the next question from Leiba, I'm gonna give this one to Navam. How can I join research labs and where should I look?
So I know UTD has a portal of all the professors that do research on campus. The way I did research for 2 years with Dr. Delk, and the way I found her lab is I asked around, and one professor introduced me to her, and it was a pretty like rough kind of process, but only do research if you're really interested in research. I interviewed at 4 schools and none of them really asked me about my research, and even though I had like a publication and everything. So only do it if you're interested in research, or otherwise it could be very time consuming.
Okay, I personally didn't do research, and I don't necessarily think, or I don't necessarily personally feel it's necessary for dental school, and I think there's a huge emphasis on it for med school, but I'm not so sure about for dental school. For the next question is from Noel. Did any of you work as a dental assistant or go through the certification process?
So I can talk a
Zach,
little.
do you want to take that?
Yeah, so I worked as a dental assistant for the last couple of years, and the certification process was done through the UT San Antonio school, and I did it online. I will leave my email in the chat. If you're interested, you can reach out to me and I can try and find those links for you, but it's just been a really long time since I applied online. But anyway, the certification process is really simple. You just go through a couple of training courses online. You submit some forms like, you know, your driver's license, your birth certificate. You have to submit that. You have to do a course on CPR and submit your certification on that. So after you've submitted all your documents in the mail, you wait a couple weeks and then they'll send you back, and you have to like pay a small fee, and then they'll send you back your certification. saying that you're a licensed or a registered dental assistant. At that point, you're legally allowed to work as an assistant in a dental office. However, one thing I will caution you about is if you get the certification, keep in mind that most offices who are looking to hire an assistant are usually looking for somebody who has some form of experience. I was lucky because the dentist that I was shadowing reached out to me and said, hey, are you interested in assisting? And I told him I am. So that's why I went and got my certification online. So if you know the person that you're shadowing is potentially open to you doing some assisting, that's a great way to get some more experience. But just because you have your certification, it doesn't necessarily mean that everyone's going to be open to hiring you. Now, that being said, there are a lot of offices, though, who understand that you're still a student and that, you know, you don't have all these years of experience. So they might be open to taking you in and training you and showing you the ropes. So it's totally possible to find those opportunities. You just have to be patient and to look for them. So if that's something you're interested in, I definitely encourage you to go for it, and hopefully it'll work out for you.
I kind of want to add on to that because, like Zach, I actually did get my online certification, but I couldn't find a job because it is really hard to find someone who's willing to train you. So I went kind of like a non-traditional route, and I found a free clinic, actually the one at the Masjid in Plano, and the people there that were already the dental assistants, they were like willing to train me and stuff. So you don't necessarily have to go to a clinic. You can try the free clinics. If that could be another option too.
Yeah, and some of those free clinics, you don't even really have to have a certification. I know I went and did some volunteering at the Allen Sachs Dental Clinic, which is located in Arlington next to UTA, or UT Arlington, and they'll allow students to do some minor assisting without any kind of a certification. So if that's what you're interested in, you might not have to go through the hassle of getting your certification.
Okay, thank you so much, you guys. Just to correct myself earlier, someone was asking me about accessing the pre-med lecture. I typed in the Facebook group wrong, so I'm gonna go ahead and correct that. So the next question is, sorry, I'm trying to find it. Okay, it's from Rashida. I hope I said that correctly. Forgive me if I didn't. Is the career path to medical school and dental school somewhat similar? So I think in terms of like the application process, it's very similar. A lot of the same, it's pretty much all the same prerequisites. It's the same application within Texas. So TMD SAS is the application that applies to all Texas schools, and it's available to medical schools and dental schools. So it's pretty similar. Anyone else wants to add to that?
The only thing I would add to that is something that Leena mentioned earlier, was that dental schools don't necessarily emphasize research, but medical schools do. So I know a lot of my friends in undergrad were really between medicine and dentistry. And so if you're one of those people, I recommend that you do some research until you figure out exactly what you want to do. Because if you decide that you want to apply to medical school later on in your college career, you don't want to start doing all those things that medical school likes to see last minute. So you might as well go ahead and get that started early on. And then if you decide you want to do dentistry, it doesn't hurt to have that experience. But like Nagam said, it's not always going to be, something that they really highlight during your interviews or when they're looking at your application. So keep that in mind as well.
And I think in terms of like dental school and med school, like once you reach to dental school and med school, pretty much the only year that's kind of similar to medical school is the first year, where you're getting basically all your anatomy, all your physiology. But for dentistry, when you move forward in dental school, you're you start taking more courses directed solely to dentistry, and so you take like surgery, oral surgery classes, orthodontics classes. So that's kind of the difference between medical school and dental school. And the next question is, how many hours of shadowing and volunteering are considered competitive? Nagam, do you want to take that?
I'm sorry, I don't see the question. What is it again?
How many hours of shadowing and volunteering are considered competitive?
I honestly don't have like a specific number, but I did have like 100, and I think like you just keep it realistic. I think 100 hours is enough of shadowing. You know, if you have more volunteering, that would be also great, but I don't know, there's no limit on how much, but like also don't keep it less than 100, I guess.
I know what Donna said during the presentation though, it's better to like have longevity than just like a lot. So if you start something from freshman year and you end it in senior year, that's better to have than like a bunch of hours, just because it shows like more determination, more persistence, versus just trying to do as much as possible in a short given amount of time.
Yeah, I think shadowing dentists for a very long time is really like a good idea, because then you can also ask them for a recommendation letter, which is required.
To add on to what both Emin and Nagam said, I worked a lot in undergrad in very service-oriented fields. So I tutored a lot of hours, and I worked at a wellness center. So I did a lot of basically like teaching. I was a health educator, so I taught throughout the UTD campus about different health topics. And although it wasn't considered shadowing or volunteering because it was a job, it was still pretty a competitive thing to put on my application, because it was committed positions that I was doing service in. So I just wanted to add that for that question.
Also, I just want to add, it's not necessarily like a time amount. They're kind of looking at your application as a whole, right? So they're looking at the classes you're taking that year. They're looking at if you're working. They're taking that all into consideration. So it's not necessarily let me get 20 hours of volunteering in. They're saying, are you utilizing your time in the most efficient way?
Yeah, that's a great point. Exactly. The next question is, what's the most important thing to have on your application in high school? Leadership positions, grades, extracurriculars, and what's a generally good GPA SAT score you should have when applying? So in terms of high school, I think your high school SAT scores, GPA, and all of that is most important when you're applying to your undergrad program. I think they do ask about it in TMD SAS, but I don't think that's something they really bring up in your interviews, is stuff you did in high school necessarily, but high school is a great opportunity to get yourself trained to be a good undergrad student, and to do well in undergrad, because that's kind of the bulk of what counts when you're applying to dental school. So does anyone want to add to that about high school?
If you're like want to do something in high school, you can join the ESPA program, because all of the people that I went to ESPA program with, I ended up seeing the first interview that the school being ESPA thing you can do in high school to have a really good, to like start having good application.
Yeah, so in terms of high school, a good GPA and SAT score, I think that really only is super applicable to getting into an undergrad college. I know that really matters when you're I knew that mattered to me when I was applying to UTD, and I know UTD is getting a little bit more competitive. So I think that's kind of more of an emphasis of like what's important in high school. But I think when it comes to in terms of a good GPA for a college applicant to be applying to dental school, I I think the average GPA for accepted students in Texas for our year was a 3.74. And for you have your academic GPA, which is all your classes you took in undergrad, and you also have your science GPA. So, and the average science GPA is about a 3.67 of accepted students in Texas. So I hope that answers your question. So the next question, is there a way that if we want to see the slides again, do we go to the Facebook link? I believe we will be posting it on the MWAPA website once we get the recording finished and all of that. So yeah, I will share the Google Doc link. The next question is, if you are given the choice of doing AP classes or dual credit classes in high school, which would be more beneficial for medical/general school?
I think the biggest advice, I think Zach would agree when I say this, is that you have the choice to take AP biology and you have the choice to take community college biology. But the thing is, especially for community college biology and university level, they teach kind of almost two different curriculums. And the biology at the university level, it kind of is like the foundation for not only all your upper level biologies, but also you're gonna see in the DAT, and it comes up your whole first year of dental school. So I think for that class specifically, like try your best to take it in university level.
Yeah, and I think, sorry, go ahead, Zach.
I was just going to say, I definitely agree with what Emma's saying. I took biology 1 and 2 at a community college, and it did not prepare me for what I was taking at UTD in terms of biology courses.
I think in terms of dual credit, those would be beneficial for, so if you're at a 4-year undergrad, you're going to have to take like English prereqs and history prereqs. If your high school offers dual credit for like English and history and stuff like that, I think it would be more beneficial because you'd be able to get those prerequisites taken care of. Because I personally, when I went to UTD, I only did AP classes. I didn't do any dual credit, and I couldn't apply my AP bio because, I mean, I could apply my AP bio, but they recommend you take biology at a 4-year undergrad. So AP bio didn't really do me any help, but my AP English classes did apply. So AP English classes, dual credit also works. So in terms of like non-science classes, I would say more dual credit, but AP classes for non-science could also help you.
And like, I agree with Leena, just because like when you take these dual credit AP classes, it kind of allows you kind of almost to graduate a semester early. And a lot of times because you're jumping into dental school and it's a lot mentally, you kind of want to have a little bit of semester break before you go in. And that's kind of what I did. I gave myself a semester break. But I remember talking to Nugum, and she said that she wishes she kind of did that early on because she went directly into dental school without a break in between.
Yeah, and to sort of just to add about the AP classes topic, I would say AP classes, science AP classes, and just AP in general, that helps you get into college. But when it comes to dental school, professional school, a lot of them won't accept AP credit, especially if it's science, in lieu of taking it at a university. So you're going to end up taking, if you took AP bio, you got a 4 or 5 on the exam, you're going to end up retaking it in college anyway if you plan on going into a healthcare profession.
Donna, I think we only have a couple more minutes for questions, so I'm going to take as many as we can. The next question is how to study for the new boards. What resources would you recommend? That's something we as well are trying to figure out because the new boards we're the first class to take it. And so we'll be taking it our 4th year. So we're still kind of figuring that out as well. So I'm not 100% sure how to answer that, but Zach, do you know anything about that? Your curriculum chair.
Well, as far as like the new boards go, I listened to a seminar on it not too long ago, and basically what they're trying to do is they're trying to move away from just complete just like rote memorization where it's just spitting out a bunch of facts, and it's going to be more focused on understanding the basics and the concepts that you learn in your science courses and applying that to, patient scenarios. So I wouldn't really worry too much about the boards unless you're already in dental school. And if you're already in dental school, then hopefully whichever school you're at, and if it's at A&M, then you're in the same boat as us. You're going to kind of figure things out as the years go on.
What I would like to add on though is that there are some schools that started integrating their curriculum early on. Like UT San Antonio, they had a new curriculum 5 years on, versus Texas A&M, we're the first class to deal with the new curriculum. So when you're applying to dental schools, you might look into that just to see which school has had more success with their new curriculum, because as time goes on, there are going to be changes that have to occur to like adapt for the nuances that were occurring for the first class who had to deal with the new change curriculum.
Okay, thank you so much, Emin. I'm going to take the next question. I think I already answered this, but the question was piggybacking off of the AP dual credit classes. If you take an AP exam for a science course and you get a 4 or a 5, will you still have to retake it once you get to college? I would say yes. I took AP Bio and I think I forgot what I got on there, but it was either a 4 or a 5. And I still had to retake it just because I was a biology major and I was going to be applying to dental school. So they recommend you have a good foundation in biology. So it was kind of just, I took it just to take it almost. And also with Gen Chem, like you have the option of taking the AP Chem exam, but they also recommend that you take those classes in like a 4-year college. So when it comes to that, I think the AP classes that are the most helpful to maybe equate things in college would maybe be like AP Calculus if you don't want to retake that in undergrad. But you can take AP Calculus, maybe like the AP Englishes, but when it comes to science classes, you would still probably need to retake it at a 4-year undergrad. Then we have like 3 more minutes for questions. So the next question was, I'm interested in orthodontics. Is the college system similar? So I'm gonna say like, does anyone else want to take that? Emin,
Yeah,
do you
it's
wanna?
the exact same.
Yeah, it's the exact same. Basically what happens is that you're specializing. So it's nothing you have to worry till you're into dental school, and that's when your ranking matters in dental school. But I wouldn't really worry about that until you first get into dental school.
Awesome. Yeah. Once you get into dental school, that's kind of when you start thinking about specializing. And like right now as second years, we're still kind of like figuring that out. So you got time for that. Trying to find. Does it look bad in a way on your application if you take a year off after you graduate to apply and get everything done for dental school?
No, I don't think so. My sister, she went to dental school and she had like a year off and she took a gap year. I think as long as you're being productive, I think that's like the only thing that should matter if you're doing something with your time.
Yeah, I think to add to that though, like if you are taking a gap year, I would recommend trying to do something try to either shadow or assist or do something a little bit to make your application competitive. Because if you do take a gap year and aren't really doing something productive in the meantime, it could hinder your application. So that's kind of my opinion on that. Gap years are still great though, like if you feel like you need one, but I would say like try to do something in the meantime because that can only help your application. It won't hurt it. So I think we're almost out of time. So I'm gonna leave my email in the chat. And if y'all have any, like if I didn't answer your question or you have like more questions that you think of, I would be happy to try to answer them after this presentation. So I'm gonna leave my email in, and thank you guys all for coming. I really appreciate it, and I hope it helped. Like we were all in your shoes at one point, and we were all like thinking about all the same questions and stressed out and just wanting to get there. But like if, like Dana said, if there's a will, there's a way. And like if you put in the time and effort and you show how much you care to do something, you will be accepted eventually. You don't necessarily have to be accepted your first time. You don't have, but just showing that, like if you want to be a dentist, you will get there, inshallah. So just don't give up and just do your best, and that's all you can really do. Anyone else have any closing remarks from the panel?
Like the traditional way isn't always the right way, so don't ever be discouraged if you have to go the non-traditional way. There is a student in our class, he applied for 6 years before he got in, but he wanted it so bad that he took it. Also, if you don't get in your first time, nothing to be discouraged. There's always a post-bac program, which is like a master's program that could help your application, if anything. And a lot of people don't get in their first year. So just don't ever be discouraged if it doesn't happen the way you want it to happen, because if you want it to happen, it's going to happen.
I also added my email if anyone wants to ask some questions. I'll be happy to answer.
Okay, thank you guys so much. I'll leave it open for a minute or two longer just so you can copy down our email if you need to. And good luck in all your future endeavors. We wish you luck.
Bye.
Bye, everyone.